Do you often get stomach pains or nausea? Hi everyone, welcome back to the channel. Today we're talking about a bacteria that you may have never heard of, but that could be silently affecting millions of people. Helicobacter pylori, or H. pylori. This tiny organism lives inside of the stomach and can cause inflammation, ulcers, and even increase your risk of getting stomach cancer. Though infections are very common, many people do not experience notable symptoms, making it a silent threat. But don't worry, knowledge is power. In this video, we will explore how H. pylori is transmitted, its potential impact on your health, and most importantly, what you can do to protect yourself. So what is H. pylori and how does it spread? H. pylori is a spiral bacteria that lives in the acidic environment inside of our stomachs. It weakens the protective lining inside of our stomach, allowing stomach acid to irritate the sensitive tissue beneath, leading to inflammation called gastritis. Over time, this can lead to the development of stomach ulcers and even stomach cancer. Approximately 35 to 40% of people in the United States are affected by H. pylori, which means about 1 out of every 3rd person has H. pylori. Studies have shown that less than 3% get stomach cancer, which means that approximately 1 out of every 100th person in the United States is at risk for stomach cancer caused by H. pylori. Now, here's where it gets important. H. pylori is primarily transmitted through your saliva. Think about it. Sharing utensils, kissing, even being exposed to droplets from someone's cough or sneeze, especially amongst family members, can all facilitate the spread of this bacteria. While less common, it can also be transmitted through contaminated food and water. This emphasizes the importance of good hand hygiene, which we will later discuss. So what are the symptoms and long-term risks of having H. pylori? Many people who have H. pylori experience no symptoms at all. However, if you do have symptoms, you may experience a burning or gnawing pain in your stomach, nausea, frequent burping, abdominal bloating, and unexplained weight loss. These symptoms can mimic other digestive problems, so it's essential to see a doctor for proper diagnoses if you're experiencing any of these symptoms. But then again, many people do not experience symptoms, and if left untreated, long-term or chronic H. pylori can greatly increase your risk of getting peptic ulcers. Peptic ulcers are painful ulcers that develop inside the lining of the stomach, or the first part of your small intestine, aka the duodenum. And if you do develop ulcers, studies have shown that 70% of people do not have symptoms. What's concerning about this is the link between H. pylori and stomach cancer, because H. pylori is considered a major risk factor for stomach cancer. So how would you diagnose and treat H. pylori? So if your doctor suspects you may have H. pylori, they may perform some tests. These might include breath tests, stool tests, or a biopsy taken during an endoscopy where they use a flexible rod to go in through your mouth and to take a look inside of your stomach. Don't let these tests scare you. These tests are fairly straightforward and very important for accurate diagnosis. Thankfully, H. pylori is treatable with antibiotics. Your doctor will more than likely prescribe you antibiotics along with other medications to reduce the stomach acid that develops inside of your stomach that can erode the inside lining of your stomach. Following your doctor's instructions, make sure you complete the entire course of antibiotics because it is crucial for eliminating the bacteria. Now, let's dive into the most important part, prevention. Here are 5 essential tips to protect you and your family. Number 1, hand hygiene is key. Wash your hands thoroughly with soap and water, especially after using the restroom or preparing food. This is your first line of defense against any bacteria, and that includes H. pylori. Number 2, make sure you consume food and water from safe resources. Be very cautious about eating street food or drinking untreated water, particularly in areas where hand hygiene is not frequently used. This tip is arguably the most crucial tip. Number 3, Avoid sharing utensils, cups, or anything that comes into contact with saliva. It might feel awkward to decline, but politely decline when someone offers you a bite off of their fork or a sip from their cup. Your health is definitely worth it. Number 4, maintain a clean and hygienic kitchen environment. Regularly wash and sanitize countertops, cutting boards, and utensils. This helps reduce cross-contamination and reduce the risk of spreading this bacteria. Number 5, while it might sound unusual, it is worthwhile to be mindful of saliva exchange, particularly with young children who may have an immature immune system or hygiene practices. Avoid pre-chewing foods for babies or sharing utensils. So my final thought is that H. pylori can pose a serious threat to your digestive health. But by following these simple preventative measures and seeking medical attention if you experience these symptoms, you can significantly reduce your risk. Alright, if you found this video helpful, please give it a thumbs up, share it with your friends and your family, and subscribe to the channel for more preventative care tips. Stay healthy, everyone. Bye!